Hello, this video has been created to help you understand your proposed surgery. It has been made using AI technology. It is designed to support you in making an informed decision about your care. Watching this video does not replace discussions with me or my team. Instead, it is designed to give you additional information and to answer some of the questions you may have. You will have the opportunity to ask further questions in clinic before deciding whether to go ahead with surgery. What is a partial knee replacement? The knee joint has three main compartments: the inner or medial compartment, the outer or lateral compartment, and the area behind the kneecap. In a partial knee replacement, only the damaged compartment of the knee is addressed. The healthy parts of the knee, including the ligaments, are preserved. By only operating on the damaged part of the joint, the operation is less invasive than a total knee replacement. By preserving the remainder of your knee, including the ligaments, it allows your new knee to function more like a normal knee than a total knee replacement would. As a result, you can expect a simpler, faster recovery and a better functional outcome with a partial knee replacement compared to a total knee replacement. It's important to note, however, that because some of your knee will be left intact, it is possible to go on and develop problems with the rest of the knee in the future, which can then lead to further surgery. Statistically, however, this is uncommon and only affects approximately 1% of cases per year. If your individual risk was higher than this, then we'd be recommending a total knee replacement from the start. Who might be suitable for a partial knee replacement? A partial knee replacement is not suitable for everyone. It's typically considered if arthritis is limited to one compartment of the knee ligaments are intact, and the knee is relatively stable and not significantly deformed. It's not suitable in cases of inflammatory arthritis where the disease progress tends to progress from one compartment to another. Expected benefits. The main aims of partial knee replacement surgery are to reduce knee pain, improve function and mobility, and to help you return to everyday activities. Most patients get an excellent outcome, but pain relief may not always be complete. Symptoms can develop in other parts of the knee over time, and as a result, further surgery may be needed in the future. What does the operation involve? You will have had an MRI scan to allow us to plan your surgery. This scan allows us to choose the ideal implants for your skeleton and also decide how much bone to resect and exactly where from. Surgical guides are then made specific to your knee, which enable us to carry out the surgery accurately. This process significantly affects your eventual outcome, and at your next appointment I can show you the planning and what your new knee will look like. The operation is usually performed under a spinal anaesthetic with sedation or a general anaesthetic. The surgery typically takes around 45 minutes. After surgery, most patients start walking on the same day. Hospital stay is typically shorter than with total knee replacements and is often only 1 or 2 days. Physiotherapy begins early and continues after discharge. Ice is key to recovery. Risks and complications. All surgery carries risks. Risks shared with other joint replacements include infection. This is very uncommon and less common in partial knee replacements than total knee replacements. In my practice, the risk of infection is under 0.5%. Blood clots can occur, but are uncommon. We will start you on aspirin the day after surgery to help avoid this. If you're normally on blood thinners, we will make a plan to stop these a few days before surgery and then restart them the day after your operation. Nerve or blood vessel injury and fracture of the bone are very rare after this surgery, but there will typically be a small numb patch on the outer side of your scar. Specific risks to partial knee replacement includes the progression of arthritis in other parts of the knee, with a need to convert to a total knee replacement in the future. Other possible risks include stiffness, which is very uncommon after partial knee replacements, as well as implant loosening or wear. Your personal risk depends on your general health and knee condition. Recovery and rehabilitation. Recovery is quicker than after a total knee replacement. Most patients use walking aids for a shorter time and generally only 2 to 3 weeks. Return to normal activities occurs within 4 to 8 weeks, but exercises to strengthen the knee need to be continued for 6 to 12 months. In the early stages, ice is absolutely key, and most patients will ice their knee 2 to 3 times a day for the first week or two, and then at the end of the day up to 6 weeks. Overall improvement can continue for at least 12 months after surgery. How long does a partial knee replacement last? Partial knee replacements can last many years in suitable patients, and most will last 15 to 20 years. However, some are exchanged for a total knee replacement earlier than this if the disease progresses throughout the knee. Making your decision. It's important that you understand the benefits and risks, have had your questions answered, and feel you have had enough information to make a decision. You can take time to think about this and discuss it with your family, carers, or your healthcare team. You may also choose to delay or decline surgery. Next steps. If you have any questions after watching this video, please make a note of them and we can discuss them at your next appointment. At that appointment, we usually review the 3D planning for your surgery together. I will show you what the new joint will look like and explain how the planning decisions were made. We will also complete a consent form together. Thank you for taking the time to watch this video, and we'll discuss things further in clinic.